Good afternoon, everyone, and thank you for joining us today for Workbank ThinkTank. My name is Christian, HR Manager of Workbank, the job site that lets you job hunt with benefits. To know more about Workbank, please watch this. Please regularly visit workbank.com for the freshest jobs that are available out there. You can also check out the website for any available or any upcoming trainings. And we also have job hunting and career tips. So, wherever you are, Workbank is here to support you every step of the way. For now, let's go on with the show. Please welcome my co-host today, Workbank's Customer Success Manager, Carla Corre.
Hello, good afternoon, Christian, and to everyone watching. And thank you for supporting Workbank Think Tank. So it's been over 6 months since the first community quarantine was implemented, and our lives has changed since. Our current normal, at least for most of us, is to live out our lives without stepping out the foot of our homes. We work from home. We have goods delivered to us. We log into Zoom to see our friends or to have a workout. We've lost privileges that keep us sane, like a good massage, mani and pedi, going out with your friends. So, to all watching today, let me ask you this. How are you doing? How are you feeling? How are you really? So, let us know how you feel via the comment section below.
You know what, Carla, such an eye-opening way to open our show today. I know I've been personally missing out, on having freedom to play basketball with my barkada, or to go out for beer, or to go to, the mall with my son, and the movies with my wife. I suppose most of us would say we are coping, but in reality, I believe a lot of us are really feeling down and lost, not knowing when this will end and when we can go back to the way things used to be.
Yes, that's true, Christian. Our guest today will talk us through our feelings and remind us why taking care of our mental health is so crucial at this time. She is a licensed psychologist practicing in the area of clinical psychology for 10 years, while 17 years in the area of human resource and industrial psychology. An educator for more than 10 years, she serves as assistant professor at the De La Salle University Manila and an associate professor at the De La Salle College of St. Benilde. She is also a research and development director for Profiles Asia and People Dynamics, where she has contributed her extensive knowledge in test development with the application of psychological principles. Let's all welcome our guest for today, Dr. Mariel Kristine T. Rubia.
Okay, good afternoon, everyone. Thank you for that wonderful introduction, and thank you for inviting me over. So, for this afternoon, I will be talking about mental health in this time of pandemic. And to start with, let me share first my screen.
And just a reminder to all our viewers today, please post your questions in the comment section and we will read them later to Dr. Rubia so she can address them. Go
Okay.
ahead, Doc.
Okay, thank you. Okay, so to start with, I'll be discussing three important points in this presentation. So the first is the significance of being aware what is mental health. And then the second one would be what are the effects of the pandemic to our mental health. And the third one, which is the most important, is what are some of the coping strategies that you can apply in your day-to-day living. Okay, so in times of fear and uncertainty, when threats to one's own survival and that of others become one of the main issues of daily life, many believe that mental health care can wait and that efforts should focus on preserving life. However, mental health is precisely one of the keys to surviving this pandemic and all that it entails in the short, medium, and long term, from the potential crisis in the provision of health services to helping preserve and reconstruct a post pandemic society. Let me emphasize that we need to prioritize and give importance to mental health, as there seems to be an unequal treatment of the two kinds of health, which is physical over mental. And this is also in consonant with our society's ongoing disregard for psychological stability. For instance, insurance does not offer parity of coverage, and treatment for mood disorders such as depression is generally deemed a luxury. But we are in a dual crisis of physical and mental health, and those facing psychiatric challenges deserve both acknowledgement and treatment. While information for the medical aspects of disaster surge is increasingly available and are continuously being available, there is little guidance for healthcare facilities on how to manage the psychological aspects of large scale disasters that might involve a surge of psychological casualties. According to a psychologist named Longstand, social isolation is twice as harmful to a person's physical health as obesity. So the question now is, what is mental health? Okay, so mental health, according to the World Psychiatry published last June 4, 2015 by Galdarisi, Kastrup and Company, is a dynamic state of internal equilibrium, which enables individuals to use their abilities in harmony with the universal values of society. So this would include basic cognitive social skills, the ability to recognize, express, and modulate one's own emotions, as well as empathize with others. It also includes flexibility and the ability to cope with adverse life events and function in social roles. It is the harmonious relationship between the body and mind that represent the important components of mental health, which contributes to varying degrees to the state of internal equilibrium. So given this, mental health is a crucial and critical healthcare service. For many, it is a matter of life and death. To simply put in, mental health is not an indulgence. Sometimes we have this tendency to equate mental health and mental wellness, thus putting mental health on the sidelines. And because of this lack of proper emphasis placed on mental health, people will continue avoiding proper treatment and accessing professional care. So, in relation to the current situation that we are in, which is the pandemic, what are the two triggers of mental illness? So the first one is sadness, when we fear for our lives. And the second one is stress, when our emotional attachments decay as a result of social isolations. Now, these isolations may have remedies by joining Zoom cocktails, but it does not mitigate any for the many people because it depends on a case-to-case basis. When the mental health benefits of seeing someone you love are greater than the physical dangers of such encounters. According to Dr. Tiffany Field, touch deprivation exacerbates depression and weakens the immune system. On the other hand, positive touch stimulates the vagal nerve and reduces cortisol, a stress hormone that can impair immune response. So this is wherein you can see how important it is for us to see the presence of our loved ones, to be able to touch them and to be with them physically. So given all these scenarios, we would see how the study of mental health is significant, especially in the aftermath of pandemic. And to emphasize more, let me highlight some of the significance of mental health. So a pandemic is an epidemiological crisis, but also a psychological one. So when we say it's epidemiological, it means it is relating to a certain incidence, distribution, and control of disease. But the question is, why is it a psychological one? Okay, it is a psychological one because the situation itself provokes anxiety, stress, and sadness. It is a time of collective sorrow. We have to recognize that we are in the middle of this collective grief. We have lost something and we are losing something now. A series of losses from our sense of safety to our social connections to our financial security. And these losses can only be put to a proper perspective with the help of a mental health professional, as the psychologists or even the psychiatrists would point to ways that we can heal. Another is there is an experience of communal grief. This communal grief is brought about by the destabilization of our jobs, healthcare system, education, and even our economic system. This crisis is not just shaking our faith on those systems, but it makes us question our understanding of the world around us. We have to remember that in this time of pandemic, we didn't just lost lives. We didn't just lost our freedom and social connections. There are so many losses, and that includes our sense of predictability, control, justice, and the belief that we can protect our children and our elderly loved ones. So these are the reasons why an understanding about mental health is significant in these trying times. Psychology has a purpose in the midst of this crisis, and it can either embrace its purpose or retreat from it. So given this, the question now is, what is the impact of COVID-19 to a person's mental health? But before I answer this question, okay, so let me have first a poll question to everyone, okay? So I'm interested to know, like, how did you feel the moment that ECQ was implemented in our country? Okay, so this is my first poll question. How did you feel the moment that ECQ was implemented in our country? Okay, and there are choices for this. Is it letter A, anxious, letter B, surprised, letter C, fear, letter D, sad, letter E, happy, or letter F, unaffected? Okay, so maybe you can tell me your answers through the chat box also. Okay, so once again, the question is, yes, Christian, can you help me
Yeah,
with this?
so right now, Dr. Mariel, we have numerous people who are now posting their comments in our
Okay,
Facebook
thank
Live,
you.
and we actually have several answers. So they're saying that they were anxious, fearful, and of course sad when the pandemic started.
Okay, so thank you for that response. Okay, so most of the responses of our audience is very much related to the impact of COVID-19 to our mental health. These are basically some of the symptoms of mental disorder, which are very, very common in these trying times. Okay, so moving forward, based on research. So these are the following identified symptoms of that we have gathered based on scholarly journals, okay, that were published. Okay, so some of the impact is that there is an experience of loss of control, and also based on a journal written by King Wing Chen, they made mention about psychological deterioration, which involves increased symptoms of anxiety, depression, feelings of fear, loneliness, abandonment, and even stigmatization. Okay. Other impact of COVID-19 to our mental health includes widespread feelings of helplessness, and then also some symptoms of PTSD, or what we call the post-traumatic stress disorder, and then some symptoms of depression, and then increased vigilance, especially when it comes to cleanliness and hygiene. And for those people who have pre-existing mental health conditions, they have long-term effects of the symptoms. And then also there is grief, okay? Grief, and of course, a feeling of disappointments for missing some of life's milestones. So what are these life milestones that we consider, such as if you are graduating this year, you were not able to celebrate it with your classmates physically. It also includes, let's say, for instance, your 18th birthday or weddings. So yun yung mga importanteng life milestones. Okay. And then some common mental illness and distress, which includes also transient mild to moderate depressive symptoms. So when we say it's transient, it means it's very episodic lang siya, very short, okay? But it's there. Some symptoms of depression is there, that, like feelings of sadness, loneliness, okay? And then feeling more anxious and worried more than usual. And then people with pre-existing psychiatric vulnerabilities may also develop into a full-blown, let's say, anxiety disorder or post-traumatic stress disorder. And then for children, these were the identified effects of COVID-19 to them, psychologically speaking, and that includes clinginess, distraction, irritability, feeling of uncertainty, and there is also the presence of worry. And then for those children who have pre-existing psychiatric conditions, or children with special needs also, they are described to be more irritable. There is also a presence of aggression and also social withdrawal. So now, what are the top three common mental disorders that were identified in this time of pandemic? So this one is based on the world record, while here in the Philippines, the top three that were identified is first is the anxiety disorder, and then followed by depression and then stress, okay? But this one, this is based all over the world. So the first one is PTSD, or what we call the post-traumatic stress disorder. Okay, so the PTSD is a psychiatric disorder that can occur in people who have experienced or witnessed a traumatic event. Okay, so one of the most important requirement for you to have this kind of disorder is that um, it should be there is an exposure to a traumatic or stressful event as a diagnostic criterion. So the exposure could be either it's direct or indirect. Okay, so when I say indirect, it means that you learn about the trauma from a relative or a close friend, or it's an indirect exposure to aversive details of trauma, usually in the course of professional duties. Like, for example, those who are prone to PTSD could be it could be psychologists also. Let's say there is a patient telling them about their traumatic experiences, okay? So they could also be, the psychologist could also be prone to PTSD, just learning about that experience from the patient, okay? And then the second criterion is that intrusion symptoms, okay? So still we are under PTSD, which means that the traumatic event is persistently being re-experienced in the following ways, okay? So there is this unwanted, upsetting memories, nightmares, flashbacks, emotional distress after exposure to traumatic reminders, and physical reactivity after exposure to traumatic reminders. And then, of course, there is the presence of avoidance, okay? So it could be avoidance to trauma-related thoughts or feelings, or external reminders about the trauma, okay? Now, the next criterion is negative alterations in cognitions and moods, okay? So meaning to say, for instance, let's say this patient was a victim of rape, okay? And during cross-examination in court, the patient was unable, or the victim was unable to recall, okay, the event that happened when she was raped. So that falls under inability to recall the key features of trauma. And then overly negative thoughts also. And there is also the presence of exaggerated blame for the self, negative affect, okay? So being, meaning to say being pessimistic almost every day, and then decrease interest in the activities that you usually enjoy. And there is also a feeling of isolation and difficulty experiencing positive affect. And then following that, another important criterion in PTSD is alterations in arousal and reactivity. So this one would include feeling irritable, or displaying symptoms of aggression, engaging yourself into risky behavior, hypervigilance, okay? So sobrang you're too alert on some things, and then heightened startle reaction, difficulty concentrating, and difficulty sleeping. Okay? And of course, for you to qualify as a person with PTSD, there is a certain duration. Okay? Na dapat you should pass this duration. So symptoms should last for more than 1 month. Okay? And then there is also a functional significance, wherein the symptoms create distress to your socio-occupational functioning, meaning to say you cannot anymore perform your day-to-day tasks in your job. You cannot anymore take good care of yourself personally. And then there are also some exclusions to this, okay? So symptoms are not due to medication, substance use, or other illnesses, which means that it is important for us, especially to us psychologists, to rule out first physical conditions of the client, okay? Like for example, yung medical history nila, baka naman it might be that they are experiencing hypothyroidism or hyperthyroidism, okay, which causes such alertness, and it's not naman pala, it's not PTSD, okay? So dapat ma-rule out yon, okay? So there are other dissociative specifications that needs to be included. And this would be, one is, it could be either the personalization, wherein when you're experiencing this, you feel that you are detached from yourself. For example, there is a feeling as if this is not happening to me, or am I in a dream? So something like that. And then another, it could be a feeling of, or an experience of derealization, meaning there is an experience of unreality, or you believe that things are not real. Okay. And then there is also this delayed specification, which means the full diagnostic criteria are not met until at least 6 months after the trauma, although the onset of symptoms may occur immediately. Okay? So the next commonly identified mental disorder is depression. Okay? So, or otherwise known as clinical depression. So this is a kind of mood disorder. Okay? And for you to be diagnosed with depression, okay, symptoms must be present for at least 2 weeks. Okay? And there should be at least minimum of 5 symptoms or more, okay, for you to be diagnosed with clinical depression. So again, this is different from the ordinary sadness that you experience, okay, because there is a certain diagnostic criteria that would qualify you to have that clinical depression. Okay, and it is also required that at least one of the symptoms should either be depressed mood or loss of interest or pleasure in the activities that you normally enjoy doing. So apart from that, those two that were mentioned, what are some of the other symptoms? Okay, so there is also a significant loss of weight, slowing down of thoughts, reduction of physical movement, such as when you feel lethargic, yan, and when you easily feel tired or experience fatigue. And then there is also this feeling of worthlessness, hopelessness, and then there's this also feeling of diminished ability to think or to concentrate. And most importantly, there is also this feeling of recurrent thoughts about death or yung suicidal ideations. Okay? So to receive a diagnosis of depression, these symptoms must cause the individual clinically significant distress or impairment in your social-occupational functioning. Meaning to say, once again, I would like to emphasize that you can no longer take good care of yourself on a daily basis, and you cannot work properly, okay? And the symptoms must also not be a result of substance abuse or another medical condition. Okay? And then the third one, okay, is the generalized anxiety disorder. Okay? So, GAD or generalized anxiety disorder is diagnosed when a person finds it difficult to control worry on more days than not for at least 6 months, okay, and has 3 or more symptoms. So the minimum number of symptoms for you to qualify as a person with generalized anxiety disorder is at least 3, okay? Now, who are more prone to this type of disorder? Okay, I'm sorry, ladies, but it's the women, okay? So women are twice as likely to be affected with generalized anxiety disorder. So the disorder comes gradually and can begin across the life cycle, though the risk is highest between childhood and middle age. Okay, so the exact cause of GAD is unknown, but there is an evidence that it could be hereditary. It could be because of the family background and life experiences, particularly those that are stressful ones. Okay, could play a big role. Okay. So what is the criteria for this disorder? So there is this excessive anxiety and worry, and then the person also finds it difficult to control the worry. And also the third one is that the anxiety and worry are associated with three or more of the following six symptoms, which includes feeling restless, okay, being easily fatigued, difficulty concentrating. Okay, so there is this presence of thinking disorder, meaning to say you cannot focus, you cannot remember things. Sometimes you don't understand yourself, or others could not understand your train of thoughts. So yon. And then there is this also irritability, muscle tension, and also some sleep disturbances. Okay. So the disturbance is not better explained by another mental disorder, such as panic disorder or anxiety disorder, etc. And then the anxiety, worry, or physical symptoms cause clinically significant distress or impairment to your social occupational functioning. So once again, okay, so one of the key features is that the person could no longer take good care of themselves. Okay, they can no longer function in their job well. So that's all about it. And then the disturbance is also not attributable to the physiological effects of a substance such as drug abuse or medication. So kailangan ma-rule out yun. Okay? So how do we cope? Okay? So, but given this, I think I have another poll question for this one. Okay. So my question is that how do you feel about the way your organization is handling our current situation? Okay, which is the pandemic. Okay. So these are the choices. Letter A, I feel secured about my organization's way of handling the situation. Letter B, I feel insecure about the way my organization is handling the situation. Or is it letter C, nothing, I am unaffected and I don't mind how the organization is handling the situation. And letter D, I feel satisfied and happy. Letter E, I feel quite disappointed. And letter F, I feel very disappointed. Okay, so maybe I can ask help from Christian for this one. Okay. So
Okay,
are the
guys.
choices okay?
Yes, guys. So, doon sa mga nanonood sa Facebook Live natin, don't forget to answer the posted poll. It's already posted in our comment section. No. So, hintayin lang natin sandali. Wait.
Yes,
Okay.
Doc, sorry,
Yes.
meron ng mga sumagot ng poll. Merong isa, letter F, I feel very disappointed. Meron naman from Alex de la Cruz. Ang answer niya is letter B, I feel insecure about the way my organization is handling the situation. A lot of letter B, si Michael Cross. Meron ding mga sumagot ng letter A, which is I feel insecure. I feel secure about the way my organization is handling the situation. That is from G. Sumanga and Marie Revilleza. Yon, so Doc. Ang daming
Okay.
sumagot ng letter A.
Letter A. Okay. So thank you so much for that. And the reason why I asked that question is because somehow the way organizations handle this current situation that we are in affects, okay, the mental health of employees. Okay. So yun. So it's very important that the organization is handling very well, okay, this pandemic, okay? So let's go now to coping, okay? So let us remember that our brain has a wellspring of self-produced neurochemicals that turn the pursuits and struggles of life into pleasure and make us feel happy when we achieve them. Let us remember that our biological design is generous, but it becomes dormant if we don't know how to trigger them. Okay? So this means that we can actually achieve happiness through daily physicality and lifestyle choices. Okay? And that is something that you will learn under the discussion about coping. So actually, the downside of living in a digital age, especially now in this time of pandemic, is that we are increasingly removed from our physicality and each other. So what's next when this happens? Our body has a tendency to short circuit. The balance of neurochemicals that evolved for millennia has been disrupted by our modern lives, making us more prone to depression, stress, and anxiety. So usually, if pharmaceuticals would intervene, or even a psychiatrist, they would simply solve the problem by prescribing a pill or some medications. But my goal as a psychologist is to guide my patients or my clients in terms of applying simple lifestyle choices and changes in behavior that can improve their brain chemistry, thus making them feel happier, better, and maximize their human potential. Okay. So what are some of the coping mechanisms that we can make use of? So I'm very sure that some of the coping strategies that I will be mentioning here are familiar with you already. So let me just emphasize, okay, the importance of doing these coping strategies. So first is exercise, okay? So regular exercise improves your overall mood. So based on research, regular exercise for at least 30 minutes each day will improve your mood, and long-term cardiovascular exercise will boost your serotonin levels in the brain. Now, this serotonin level that I am talking about is a neurotransmitter that is being naturally released by our brain, and the higher the production of the serotonin levels in our brain, the happier we become. Okay? And it is also responsible why we feel sad sometimes for no apparent reason. It means that your brain is producing a low level of serotonin. Okay? So at the same time, when you also exercise, it lowers your tendency to be hostile against other people, and it lowers your susceptibility to depression. And also, one important thing, it encourages agreeableness. Okay, so you become more cooperative as a member of the team when you exercise. So you see, ang daming benefits ng exercise. Okay, the next one is spending time in nature. Okay, so research found that as little as 5 minutes exposure to nature, okay, so yung outdoors in a natural setting can improve your mood, okay? Specifically, it increases your motivation and self-esteem, okay? So the amount of time spent in sunlight correlates with serotonin and dopamine synthesis. And just for you to know, when there is an increased amount of serotonin in our brain and increased amount of dopamine, it makes us more happier. Okay, it makes us happier. The next one is in terms of nutrition. So what are some of the food that we usually intake in our body? Okay, so just for info, Please take note of this one. This is very important as a lot of you might be a coffee addict. Okay. So coffee increases serotonin and dopamine levels for as long as you are taking it, but can create withdrawal once you stop. Okay. So this is because your brain was used to the high levels of neurotransmitters and will act as if there is a deficiency, okay, when you stop drinking coffee. So it takes 12 days of caffeine-free diet for the brain to return to its normal state. So please take note of that, okay? So the question now is, what other food can I replace, or what other fluids can I take in my body aside from coffee as a replacement for coffee? Okay, so some of the foods would include foods that are rich in omega-3 fatty acids, which will definitely boost your serotonin levels without withdrawal symptoms. And normally, you can find this from cold water fishes like salmon. Okay, so the good thing about eating salmon is that it reduces your depressive symptoms also. Okay, and then another important drink that you should have in your refrigerator is the Yakult. Okay, so this one is not very expensive. Okay, it is in fact good for fighting stress, and it's very much good for fighting depression and anxiety also. Okay, specifically the bacteria lactobacillus. Okay, so it interacts with your tryptophan. So basically, the brain uses the tryptophan to produce serotonin. And this tryptophan competes with other several amino acids, okay, for transportation to the brain. But aside from Yakult, there are also other food that are rich in tryptophan, okay, such as when you eat wheat bread, potatoes, and even corn, okay? So it makes you less prone to depression, okay? The next one is engaging into meditation and yoga, okay? So basically, meditation and yoga increases your dopamine levels. Thus, the result would be it relieves you from feeling stress and it creates inner peace, okay, within the individual. The next one is the gratitude exercise. Okay, so I want you to practice this every day of your life. You have to think of the things that you are thankful for. Think about your blessings in life, because when you do this gratitude exercise, it affects your brain's reward system. Okay, so it correlates with the release of dopamine and serotonin, and gratitude has been linked to the increased level of happiness. Okay? Others would be yung mga essential oils. Okay? So this one, I prescribe this also to some of my patients. Like you can make use of bergamot oil, lavender, and lemon. Okay? Because it increases also your dopamine and serotonin levels. And then another one is goal achievement. Okay, specifically, you have to set goals for yourself. Okay, even little goals lang yan, it's okay. Okay, because when we achieve our goals, our brain releases dopamine. So this dopamine rush is rewarding for the brain. Okay, and then the next one is happy memories. Okay, so people reliving sad memories produce less serotonin, okay, in the area of their brain. Specifically, the area of the brain that is responsible for that is the anterior cingulate cortex, okay? And then, while on the other hand, people with happy memories, okay, or people dwelling on happy memories produce more serotonin, okay? And then the next one is when we engage ourselves to something that is novel, okay? Or something that is peculiar to us, something that is new to us, okay? So basically, the brain reacts to novel experiences by releasing dopamine. So what you need to do is you need to seek new experiences, new hobbies, okay? So to promote dopamine increase, okay? And then the next one, which was proven to be very, very effective, is therapy. Okay, specifically psychotherapy. Now, when I talk about psychotherapy, it means talk therapy. Okay, so that is what we usually do as psychologists because we don't normally prescribe medications to our patients. We are not allowed to do that because we are not medical doctors. But what we do is we make use of psychotherapy or talk therapy by applying some um, different treatment modalities to our patients. Okay, so basically, research indicates that if you change your mood, you affect your serotonin synthesis in your brain. Mood and serotonin synthesis have um, mutual influence on each other, and psychotherapy basically improves the mood of the person. So therapy, in other words, raises one's serotonin level as well. Okay. So there are other ways, okay, other practical ways of interventions and coping. And some of this would include like setting up a routine, even if you're doing work from home. Okay, so even if you're in a work from home setup, you have to remember that actually, based on research, we are 5 times more prone to mental illness, especially those who are doing work from home. Okay, so that's why you really need to set up a routine and you find ways on how to take good care of your psychological well-being. Okay. So apart from that, other ways could be you have to turn off the news if it makes you feel more depressed. Okay. Sometimes kasi when we open the news and even the social media, we are overwhelmed with a lot of negative things, and some of this news are not even true. Some are fake news, and we are being prone to infodemic. Okay, so it affects also our psychological makeup in that sense. And then another is I would like to remind everyone also that when you make use of social media, just make sure that you're using it to connect with your loved ones, to feel good about yourself, to be happy. So yon. And then, of course, it is also important to create regular activities for yourself, be it indoor or if it's possible for you to go out of the house, kung safe man siya, then you create a regular activity for yourself. Okay, like maybe walking or running in your neighborhood. Just don't forget to wear your mask. And then another important thing that you should remember is to stick to a consistent sleep and waking up time. Okay. And then another is the resiliency training. Okay. So this is a form of intervention wherein it enables the participants to see challenging situations as opportunities. Okay. So that is what resiliency training is all about. And this resiliency training should include important aspects such as developing gratitude and appreciation of the person. Um, Another would be developing an internal locus of control, developing a good sense of self-esteem or a good sense of self-efficacy. So those are the things that should be included under resiliency training. And then another one is telepsychology. Okay, so this is a form of intervention wherein the provisions of behavioral and or mental health care services using technological modalities. So this is in lieu of or in addition to the traditional face-to-face methods that therapies would normally do. Like, for example, you are using telepsychology when you are using applications to track the moods of your client. Or another would be diagnostic interview via video teleconferencing or conducting psychotherapy during video conferencing. So pwedeng ganon. Okay? But it is very important for us to um, let our clients sign a consent form also in conducting this one. Okay? Yung sa telepsychology. Another is psychological first aid. Now, this one is very much in demand this day, especially in this time of pandemic. Okay, so what is this psychological first aid? So it is designed to reduce the initial distress caused by traumatic events such as the pandemic and to foster short and long-term adaptive functioning and coping. Okay, so it's an evidence-informed modular approach that usually helps children, adolescents, adults, and families in the immediate aftermath of disaster or let's say if you're a victim of terrorism. Okay. So I guess that's my last slide. I would like to leave this message to you, okay? So research have determined that a lonely person's immune system responds differently to fighting viruses, making them more likely to develop an illness, okay? So you should always remember to be happy, okay? Otherwise, you will be prone to a lot of viruses, okay? And as I end this talk, I would like to share with you something that was stated by a professor from Columbia University. It's a very nice thought, okay, about the virus, which is coronavirus, okay? Coronavirus will pass like a flu for most people who contract it, but it will be more fatal to older people and those with physically compromising preconditions. The list of conditions should, however, include depression generated by fear, loneliness, or grief. We should recognize that for most people, medication is not an indulgence and touch is not a luxury. And for many of us, the protocol of Clorox wipes and inadequate masks is nothing compared with the daily task of disinfecting one's own mind. Okay, so thank you so much for listening. Okay.
Thank you very much, Doc Mariel, for your insightful talk. And I just want to tell you that I agree with what you mentioned kanina, no, na talagang mahalaga na mapanatili nating healthy ang mental state natin, lalo na ngayon na nasa pandemic tayo. I mean, I know a lot of people who experienced cabin fever because hindi sila sanay na they are stuck in their homes, especially at the start of the ACQ last March and April. And this is why, as an HR practitioner, I am also happy that there are a lot of centers, offering free online psychological services during this pandemic that we can take advantage of, yes, to get our mental health check. Talagang hindi natin dapat, pabayaan ng mental health natin. Right, Carla?
Yes, I totally agree with you, Christian and Doc. Having heard you, Doc, I didn't realize that there's a lot of things that we can do at home to help ourselves. So I believe that it's your responsibility to take care not only of your physical health but of your mental health. Akala ko kasi, Doc, online shopping lang ang solusyon dito eh.
Okay.
All right. By the way, Doc, let me go to the questions sa ating comment
Okay.
section. So first question is from Marvelyn Padilla. She said, I'm having a hard time looking for a job due to signal at our place. I'm feeling anxious, pressure, and stress because my family is pushing me to work even if it's not my field of work. How to deal?
Okay, so for that one, okay, so I guess first is you have to um learn what are the things that you really like to do about yourself. So you should discover the things that makes you feel more engaged as a person, and what do you really want out of this life. And then upon learning about that, I guess it's very important for you to discuss that with your family members. Okay. So first is to know what you want. Okay. Then following that, it's important for you to assert yourself more. Although I know it may take time, but it's important also for you not to feel pressured about what they want for you. It's important for you to let them know, okay, what you really want, especially when it comes to your career. Okay, after all, kasi you won't last in a particular profession if you don't like it. Okay, if someone else likes it for you, then most likely at the start, siguro you will work. Okay, fine, but then eventually, you will feel more, kumbaga, depressed about your situation. Palagi kang pagod, and then you're not enthusiastic about it. So yon, it will create more problems to your mental health. Okay, so first is, again, know what you want, and then identify what are the things that interest you, know what are you good at, and then following that, discuss it with your family members. Okay.
All right. Thank you, Doc. Christian, second question.
Okay.
Yes, I have another question here, Doc, no, from Miss Jade Flora. So her question is, Filipinos unfortunately tend to be dismissive or condescending about mental health issues, mainly because of
Okay.
miseducation. So what do you think are the best ways to handle or respond to people who don't consider this as a serious problem?
Okay. So first, the reason why we're having that negative impression about mental health is because of the stigma. Okay. So there is this stigma that we experience, but the question now is, how do we decrease the stigma? Okay. First is that we already have a mental health law. Okay. And the second is that there should be at least a mental health policy in the organization where you are connected with. And then the third one is that we have this negative connotation about mental health, na it only involves illness. Okay, or let's say siraulo or buwang. Okay, it's not like that. So for organizations, I would say that you should be able to create programs that is suitable for everyone, okay? So that mental health does not only mean illness, but also happiness, okay? And then once the company starts that, it gives a positive connotation about mental health. And kumbaga nawawala na yung stigma, okay? So, yeah.
All right. Thank you, Doc.
Thank you.
Another question from Alex de la Cruz. Is there any breathing exercises that you can recommend to fight stress?
Okay, so I always tell this to my patients, okay? So what is the proper way of breathing? Okay, so let me teach you how to do it. So you breathe in using your nose, okay? And it should be slowly being done. Dapat matagal, magka-count ka at 3 to 5 seconds, and then breathe out using your mouth. And whenever you feel very, very stressed, okay, that is the initial thing that you must do. Do it for 3 times very slowly, okay? So yon.
Okay, Doc.
And it works wonders
Yes.
pala. Yes.
Okay. Yes, Doc. So I have a message here from my friend who's also watching this Facebook Live now. So her question is, he's living with someone who has mental health issues. So how
Mm-mm.
can he help, and how should he deal with it?
Okay. First is um I want also to ask, did the person ever ask for help from a mental health professional before, or wala pa?
Knowing his personality, Doc, I don't think he already seek for any assistance from any official or formal help from mental health institutions or psychological help. So I don't think so.
Okay, okay. So this is how we can help. Okay. First is dapat your friend, is that your friend? Is that correct? Your friend?
Yes po, opo.
Okay. First is that your friend should show non-verbal cues na he's open. Is that a guy or a girl?
It's a
He is.
guy. It's a guy
Okay,
po.
so that he is open to hear about
Mhm.
this family member's condition, and he must be very, very observant then kung ready mag-open sa kanya yung family member na yon. Kasi first and foremost, what we usually tell our patients is that therapy will not be effective if walang pagkukusa yung pasyente. Okay? So it should not be something that is forced. So hindi niya dapat pipilitin na maybe you should go to a psychologist. Okay? So not like that na pipilitin niya. It should be, are you open? Maybe the person, your friend can ask, are you open to discussing with me some of your concerns? Because I have noticed lately that you're not being yourself, okay? And that you seem to be lethargic. So first is i-identify niya ano yung mga na-observe niya muna. Okay? And then the next one, after identifying what you have observed, okay, please tell also the person, pag nagsabi siya, okay, do not invalidate the feeling. Alam mo, normal lang yan eh. No, not like that. Okay? So, dapat ang approach is, ang sasabihin niya is, you know, I understand, or I I understand that what you feel is valid, and siguro nga ganyan. So dapat ganon, okay? Dapat rapport should be established so that the person, the family member would open up to him. And then kapag medyo nakakapag-open na, okay, maybe he can suggest, okay, seeing a mental health professional. So but the most important thing is paano siya makakatulong, okay, at the beginning, is to show that he is just there, he is open in terms of his body language, okay, ask simple questions that are not, hindi naman intrusive, hindi rin offending, okay, yung parang kung ano lang yung napapansin mo, okay.
Doc, in relation to, sorry Doc, in relation to Christian's question, para naman doon sa, let's say, walang makausap or nahihiyang magsabi sa mga relatives or friends nila, is there a number to call?
Okay, so yes, there are hotlines also, and there are free mental health services being given by some clinics here in the Philippines also. In fact, I can maybe I can provide the list later on, okay? Because there are a lot, okay? So yun.
Yes, Doc. Doc, I think this is the last question from Miss Ayel. Is experiencing a panic attack a sign of having a mental illness?
Okay. It depends on the severity of the panic attack also. Okay. So, at saka, yun nga, that's why we have this diagnostic criteria, which I gave kanina, like for example, for PTSD, for depression. So there are several symptoms that you need to check on before you qualify that person as having a mental disorder. Okay, so but if it's just, for example, an ordinary sadness, okay, and may reason naman talaga to be sad, then baka hindi pa siya, for example, clinically depressed. So that's why there is a diagnostic criteria that we must follow. Okay, So let's not be prone to over-pathologizing. Yung sinasabi na, oy, may panic attack, may mental disorder. So hindi ganun dapat. Okay? So we have to be very, very careful about these things.
I
Okay?
see. Okay, Doc. Ang ganda ng word na yun, Doc, ha? Pathologizing.
Over-pathologizing. Ayan.
All
Yes.
right. By the way, thank you, Doc Mariel. I think we ran out of time. And salamat sa lahat ng mga tinuro mo sa amin, Doc Mariel. Hopefully, after this session, we will be able to apply this to our own homes, lalo na nasa bahay lang tayo ngayon. Thank
Yes.
you, Doc.
Thank you so much also. Thank you.
All right. Before we say goodbye, let me take this opportunity to remind you that this video and all other Workbank Think Tank episodes that we have done in the past can be found on our Facebook page. If for some reason you got dropped during the discussion or were only able to join us halfway through the show, don't worry, you can watch the entire video right on our Facebook page. Please also feel free to share the video to people you think might benefit from our topic today. And if you like what you saw today, please leave a review on our Facebook page. We would love to hear what you think. And thank you again, guys, for joining us today. And we'll see you in a couple of weeks for the next episode of Workbank Think Tank. Have a good weekend, everyone. Bye.